So, okay, so I've been following a carnivore diet for over 5.5 years at this point. So for me, protein intake is not, huge concern. For you as a vegetarian, you said you're following a vegetarian diet. How are you able to get enough protein, and how should I help coach people who want to follow a vegetarian diet to be able to get more protein?
Yes. So if you remember how I went about this in San Diego, it was kind of like meeting people where they are. I could tell them that you're at 250 grams of carb a day. Low carb is 80 to 100 or below. I mean, ketosis is 50 and below. But honestly, for it to be sustainable as they can do this for the rest of their life, I have not seen someone vegetarian be able to stay below 50. It's just been practically, especially if you're trying to get whole food and not just be on protein shakes all day long.
Right.
So the way I have offset that is by adding intermittent fasting at a later stage once I get their protein optimized. But what I do is instead of throwing them this perfectionistic prescription of, oh, it's day one, you're at 250 grams of carbs, I need you to make that 100 grams tomorrow. No, first of all, someone who's eating high carb, they're hungry all day. They are eating food all day. They're looking for food all day. There's small, frequent meals. There's snacking. There's cravings because the high carb, high insulin, they're gaining weight, they're eating. So telling them to just cut their food down makes them nervous. So what I had to do was go the other way is, oh, you're having symptoms of weakness, no muscle gains, hair fall, poor wound healing, poor skin quality, indigestion, gut issues, and you're very bad immunity, repeated infections, non-healing injuries, all of this, I can point to protein deficiency as a big connection. So why don't we give you more protein to cover these symptoms and divide your protein across your 3 meals? So start from the symptoms that they care about, because they don't really come in saying, oh, help me reduce my 250 carbs. They're saying, help me with my symptoms. So if I show them your protein deficiency is linked with your symptoms, how about we increase your protein? And then what I do is I do a food recall with them, and they have to use my app. If they're working with me over 3 to 6 months, they have to log their food into my app, where I've built it myself with my husband and my team. And we have all the Indian foods that people from north, south, east, west, all the Indian cultures, we've got it all in there so they can find their macros. And I want them to be able to log it in there and see how we're gradually going up on their protein counts.
Gotcha. Yeah, that's really good. I love that. You mentioned intermittent fasting. I don't know if this has fully been studied. It's just something that I've observed. So I'm really curious to hear what you think. In my mind, I have a specific protein recommendation that I would recommend for most people. And again, I think most people are falling like way, way, way short of that. However, when somebody does some type of intermittent fasting, time restricted eating, maybe they're only eating 1 meal or 2 meals a day, what I observe is that they may not be reaching that protein goal. However, when I'm measuring their body fat and I'm measuring their lean mass, they don't lose lean mass. They maintain lean mass on a much lower protein intake. So first of all, is that something that you've observed? And secondly, if you know the answer, great. But would you speculate if this hasn't been studied? Would you speculate that maybe the autophagy part of intermittent fasting is helping us preserve protein so that our intake we can get by with much less?
Right. So I guess I have to first get one more piece of information from the people you're seeing do it on your end. Are they taking the ketogenic type of foods or carnivore-based foods and then fasting?
Yeah, mostly eating fats and proteins, mostly
Exactly.
kind of animal fats and proteins for the most part. And
Exactly.
again, like the number isn't what I would want it to be. However, they don't lose lean mass.
Yes. So I think in your case, the answer is yes. You're right, that you will see protein sparing effect. There are studies showing that ketosis or being in fat burn ends up after a few weeks, or actually after a few days of being in that ketosis, is protein sparing. So you would be burning the fat, but you've achieved the ketosis through nutrition ketosis. So your fasting durations are shorter, but you're entering those fasts already in the ketotic state. So you don't need those super long windows. And the reason you're probably not seeing muscle loss or lean loss is because your autophagy is on. I don't know if they're doing water fasts or are they doing bone broth or something? What kind of
Yeah,
fast?
across the board. I mean, it's different for everybody, but just even
Yeah.
people eating like once or twice a day kind of a thing.
Right. So again, the autophagy is supposed to be, again, this is me reading about it, is shut down when you get any form of protein in. So even a fasting fluid that has some bone broth or collagen or something in there, it's likely to shut down your autophagy because that little bit of protein will stimulate mTOR, and mTOR will stop autophagy. But you're probably still getting the fat burn benefits, the preservation of lean muscle in your population. One of the big reasons why I don't allow a protein deficient fast in my audience is because the quality of the protein they're taking is not pure 100% animal protein. It is oftentimes a vegetarian or plant-based protein. So we're looking at some incomplete amino acids. They're having to sort of diversify to get the whole amino acid profile. So, and because it's so hard to get enough protein on a vegetarian or a plant-based diet because of the bulk and the fiber you get full, so I have to give them enough of an eating window to at least get 1.2 grams of protein per kilogram.
Got it.
And I'm not willing to compromise on that because most people coming into my program, they're already sarcopenic, they're already muscle wasted, they're very protein deficient. And because they're vegetarian and plant-based, they're not in ketosis in the eating window. They're starting from around 80 to 100 grams of carb a day. So they're not in ketosis.
Okay.
So I have to, yeah. So what I tell them is, let's make sure we do both windows well. In the eating window, we make sure protein is at target 1.2. And in the fasting window, we go long enough to get into ketosis through fasting.
Mm. Got it. Okay. That makes a lot of sense. One of my favorite moments about the conference was that Thursday, and I'm sitting next to my friend Robin, who's reversed her bipolar with a carnivore diet, as we're sitting and watching on stage Hannah Warren, who reversed her bipolar with a vegetarian diet. And I think more people need to know that there's lots of different options. And yes, we may have favorites, but there's lots of different ways to do this for many different people in different cultures and different cuisines. So I love that you explained that. I think that's super, super important and really insightful. I do want to talk about some of your content in your talk because again, it was so different and so helpful. You opened up your talk by talking about diabetes distress, which I think is really interesting and very underappreciated. How much stress there is around chronic diseases, and in particular, diabetes in particular. Can you tell us what is diabetes distress?
Yes. So again, living with diabetes is a chronic thing. It's not, a fever of 2, 3 days or a back that you pull and it's done in 7 days. It's kind of with you for life in a way. Even if you put it into remission, somehow it can be during its difficult phases overwhelming. And the idea of diabetes distress is that there are negative emotional experiences you can have. It's not depression. So everything else in your life would be going fine. You're not depressed, you're functioning fine. But when it comes to diabetes, you're low on confidence, you don't feel supported, you don't feel understood, you feel like a failure, you feel guilty, you feel like you don't have enough options or resources. And so the creators of this, the founders of the Behavioral Diabetes Institute, Dr. Polonsky and Dr. Fisher, they created this scale for type 1 and type 2 diabetes. It's a measurable, reproducible, validated survey where you can actually ask the questionnaire and people can fill it out at home. These are online free tools for clinicians to use. And the patient can understand on a 1 to 6 scale, how big of a problem are these things? There are questions like, I don't feel like I have a doctor I can talk to. I don't feel like my friends and family understand how tough this is. I'm worried that no matter what I do, I'm finally eventually going to get complications of diabetes no matter what. I always feel like my food choices are like a failure. I'm paraphrasing. I don't have the exact words and each word matters, but these are the kind of effects is how bad is this? And the higher the score, 6 being it's a very big problem or biggest problem, and 1 being it's not a problem. The higher the score, this turns into higher HbA1c levels. This turns into more complications, more healthcare costs.